The 18th century in Europe was a world where toothache was synonymous with torture. Barbers extracted teeth in public squares, and medicine turned away helplessly. Teeth decayed, infections killed, and fear overshadowed any hope. It was the Middle Ages in the mouth. But then a man emerged. His name was Pierre Fauchard. He wasn't a lone genius descended from the heavens. He was a surgeon who witnessed chaos and resolved to bring order to it. He observed, experimented, and systematized knowledge. He invented new instruments and methods: filling, prosthetics, and bite correction. He compiled all of this into a monumental work, The Surgeon-Dentist, or A Treatise on the Teeth, published in 1728. And he changed everything. It wasn't an overnight change, nor by the wave of a magic wand. He transformed a primitive craft into a scientific discipline. He gave it a name. He gave it rules. He became the father of modern dentistry. This isn't a story of a sudden discovery. It's a narrative of meticulous, titanic labor, of a willingness to learn from everyone, discarding myths and dogmas. It's the story of how one individual, step by step, brick by brick, built a new reality. Science is not magic. It's methodical, often thankless work. Pierre Fauchard's journey is the best proof of that. The 18th century was the age of enlightenment, but only within the pages of books and in the minds of philosophers. In reality, on the operating table, darkness and despair reigned. Medicine, for the most part, remained a prisoner of age-old misconceptions. The human body was perceived as a collection of fluids whose balance could be disrupted by evil spirits or bad air. Illness was seen as punishment. Treatment was often torture, only exacerbating suffering. Doctors, in the modern sense, were critically scarce. Often, help was provided by healers, barbers, or simply people passing down dubious methods from generation to generation. Their knowledge was based not on observation and experimentation, but on ancient texts and superstitions, on blindly following authorities whose theories were as far from truth as their instruments were from sterility. Inflammation, for instance, was considered a natural and even beneficial process. Pus flowing from a wound was called laudable. Its presence meant the body was cleansing itself. Doctors actively encouraged its formation instead of fighting infection. Surgical interventions were acts of barbarism. Amputations were performed without anesthesia, and afterward, wounds were cauterized with hot irons or doused with boiling oil. It was believed this would stop bleeding and prevent infection. The result? Excruciating pain, inevitable infections, sepsis, and death. Only a few survived, more by sheer luck than by treatment. Every operation was a lottery where the odds of winning were negligible. The human body, its anatomy and physiology, remained a mystery to the vast majority of healers. Knowledge gained from dissecting corpses was ignored or distorted because it contradicted established dogmas. Prevention? It was barely heard of. Hygiene? A concept absent from the lexicon. The world was full of diseases that decimated entire cities, leaving behind only fear and desolation. In this world, where pain was the norm and death a frequent visitor, there seemed to be no room for change. It was an era when ignorance and cruelty in medicine did not just prevail, they were the law. It was in this world where ignorance and cruelty in medicine were the law that Pierre Fauchard began his journey. He was born in 1678 in a small village near Angers, into a family far removed from medical circles. His background offered him no privileges. There were no noble patrons, no inherited knowledge. There was only a sharp mind and an inexplicable drive for discovery. At 17, he enlisted in the Royal French Navy, not as a physician, but as a surgeon's apprentice. This was his first university, harsh, unforgiving. On the decks of warships, far from civilization, he encountered medicine at its most unappealing: amputations without anesthesia, festering wounds doused with boiling oil, and suffering that ended only in death. And everywhere, oral diseases, decaying teeth, swollen gums, unbearable pain that incapacitated entire crews. He witnessed scurvy transform strong sailors into toothless, emaciated specters. He saw how oral infections spread throughout the body, causing fevers, abscesses, sepsis, and death. Others accepted it as a given, an inevitable cost of life at sea. But Fauchard could not. He couldn't reconcile himself with the helplessness. He observed. He asked questions. Why was this happening? Why was no one trying to understand the true causes? Why was all this suffering considered normal? He saw that official medicine, preoccupied with higher diseases and ancient theories, completely ignored the mouth. It was left to charlatans, barbers, and blacksmiths, people whose methods were barbaric and whose knowledge was non-existent. They extracted teeth without understanding anatomy or consequences. They maimed. They killed. It was there, amidst the groans of the dying and desperate cries, that Fauchard made his decision. He would focus on the mouth, this small yet vital part of the human body that was the source of so much suffering. He saw that here, in this forgotten corner of medicine, absolute chaos reigned, and he was ready to bring order to it. He decided not just to treat symptoms, he resolved to understand and to change. It was the path of a lone individual swimming against the current, a path full of challenges, but he was ready. Fauchard didn't just observe, he acted. His office wasn't the clean, sterile environment we know today. It was a workshop, cluttered with instruments, flasks, and herbs. And everywhere, teeth, extracted, studied, dissected. He dissected them, examined their structure, and sought the causes of their destruction. He saw that decay began with a small opening, expanding to destroy the tooth from within. Traditional treatments, extraction or attempts to fill cavities with something like lead paste mixed with animal fat, were useless. The paste crumbled, fell out, and the pain returned. One day, while preparing for an appointment, Fauchard discovered that his supply of the fat used to soften the paste had run out. Not a drop. An ordinary person would have postponed the appointment, telling the patient to come back tomorrow. But Fauchard was no ordinary person. He saw a suffering individual before him and recognized a problem. He looked around his workshop. His gaze fell upon a piece of tin, metal. He had experimented with it before, trying to shape it, but had never considered using it to fill a cavity. He took a small piece and carefully heated it over a spirit lamp flame until the metal became soft, not melted, just malleable. Then, using a specially curved instrument, he gently pressed the warm tin into the thoroughly cleaned carious cavity. Yes, the patient felt the heat, but it was a brief moment of discomfort. Fauchard waited. The tin quickly cooled and hardened. It filled the cavity snugly, leaving no gaps. This was something different. Not a paste that fell out in a couple of days. This was a solid, durable barrier. The patient cautiously moved their tongue. The pain that had tormented them for weeks was gone, instantly. The filled tooth no longer reacted to cold or heat. Fauchard felt something click inside him. This was it, the solution. Not perfect, but revolutionary. He repeated the experiment, again and again, with different patients, with different teeth. Each time the result was the same. The tin held. The pain receded. He had created the first reliable dental filling. This was not his only breakthrough. He witnessed people losing their teeth one by one, left with deformed jaws and unable to eat or speak. He began experimenting with prosthetics, using ivory. He carved and shaped it, studying how to secure artificial teeth, not just insert them, but anchor them so they would stay in the mouth and be functional. He invented the first dental prostheses with wire clasps and taught patients how to care for them. His methods were a challenge to centuries-old traditions and to charlatans who saw pain only as a source of income. Fauchard did not keep his knowledge secret. He documented everything, every observation, every experiment, every failure, every discovery. He systematized his notes, transforming them into rules and instructions. He was creating a science, and this science was built on tangible, visible results. It was built on alleviating suffering and restoring people's ability to live full lives. This was a legacy created not from dogma, but from real help. Pierre Fauchard didn't just see a problem, he analyzed it. His approach was radically different. He didn't accept old dogmas on faith. He asked, why? Why does a tooth decay? Why does a filling fall out? Why do patients suffer? He sought answers not in treatises but in reality. He dissected extracted teeth under a magnifying glass, studying the minutest details of the carious process, like a detective searching for clues. He saw how a tiny hole expanded, transforming healthy tissue into a decayed mass. This was empiricism in its purest form: observation, experiment, conclusion. He wasn't afraid of mistakes. On the contrary, he collected them. Every failed filling, every prosthesis that wouldn't stay, every infection he couldn't stop, became not a cause for despair, but an invaluable lesson. He recorded everything, not just successes but failures too, trying to understand what went wrong. It was this methodical work on errors, this constant pursuit of perfection through iteration, that distinguished him from his contemporaries. He didn't just treat, he learned to treat better. His workshop was a true laboratory. He didn't wait for someone else to invent the necessary tools. He created them himself. For every new method, be it precise removal of carious tissue or prosthetic fixation, new, more advanced instruments were required. He experimented with metals, angles, and shapes. His hands, accustomed to the rough work of a surgeon, now crafted tools for pinpoint accuracy: curved probes, miniature drills, forceps that didn't just pull out but extracted. He understood that without adequate instruments, new methods couldn't be implemented. He literally forged the future of dentistry. But inventing was only half the battle. Knowledge had to be shared, and Fauchard chose a path that was, in itself, an act of revolution. His monumental work, The Surgeon-Dentist, or A Treatise on the Teeth, was written not in Latin, the language of science and the elite, but in his native French. This was a conscious decision. He wanted his discoveries to be accessible not only to a narrow circle of scholars, but also to practicing physicians, barbers, and students, anyone who could apply this knowledge. He democratized information. He made it understandable. He didn't just outline his methods, he meticulously described anatomy, disease classification, the process of instrument manufacturing, and even medical ethics. This was more than just a book. It was a manifesto for a new medicine based on reason, observation, and practical experience, rather than on superstitions and ancient authorities. By publishing his knowledge, Fauchard challenged the entire medical establishment. He showed, here are the results, here is the evidence, and they work. He didn't just treat his patients, he laid the groundwork for thousands of other practitioners who, building on his work, could do the same. He was not a lone genius performing miracles in secret. He was a teacher who provided a tool for changing the world, and that tool was the written word, backed by decades of meticulous labor and a relentless pursuit of truth. The publication of The Surgeon-Dentist was not met with triumphant acclaim. On the contrary, it unleashed a storm of indignation. Doctors who had received diplomas from the Sorbonne, professors who had lectured for decades from outdated treatises, and even fellow surgeons accustomed to their place in the hierarchy, saw Fauchard as a threat. They could not accept that a man without a university education, without noble patronage, without adherence to centuries-old dogmas, dared to teach them. Accusations immediately poured forth. He was called a charlatan, an impostor, an upstart who disgraced the noble art of medicine. Who is he? They questioned. A mere barber daring to write about matters beyond his grasp. His methods were declared dangerous, unproven, and doing more harm than good. Filling, skeptics scoffed. Will this metal not poison the patient? How can one leave decay inside a tooth, simply covering it? Artificial teeth, in their opinion, were mere trifles, unrelated to true treatment. They claimed Fauchard was driven solely by greed, and his breakthroughs were nothing more than clever tricks to attract gullible clients. The medical establishment, accustomed to the immutability of its position, demanded Fauchard's book be banned. They appealed to the Royal Academy of Medicine, submitted petitions, and sought official condemnation. They wanted to strip him of his right to practice, to declare him an outlaw. For them, this was not just about defending traditions. It was about defending their power, their authority, their world built on established rules and knowledge inaccessible to common people. To make knowledge accessible to all meant undermining the very foundation of their reputation. But Fauchard had defenders, not only grateful patients whose suffering he had alleviated, but also some far-sighted aristocrats, weary of the helplessness of traditional medicine, who saw the real results of his work. They themselves, or their loved ones, had endured the agony of toothache and found relief in his practice. These patrons, possessing influence and position at court, came to his defense. They testified to his skill and the significant improvements he brought. They enabled him to continue his work, providing protection from attacks. There were also a few progressive physicians who, despite threats and condemnation from colleagues, dared to study Fauchard's work. They read it, saw the logic in his observations, and found confirmation of his words in their own practice. These few understood that the future of medicine lay not in blindly following ancient texts, but in empiricism and innovation. They could not openly support Fauchard in public, but their silent recognition and discreet application of his methods gradually paved the way for a new era. This was a battle not only of ideas, but of characters, a struggle for the right to scientific truth. And this struggle was fierce. This fierce struggle could not last forever. Pressure mounted. The undeniable results of Fauchard's work, the testimonies of thousands of relieved patients, all of it became impossible to ignore. The medical establishment, that bastion of old dogmas, found itself trapped. They could neither fully reject him nor openly acknowledge him. A solution was needed. The Royal Academy of Surgery, a citadel of centuries-old traditions, found itself under crossfire. To reject Fauchard's work was no longer possible. To acknowledge it meant undermining their own authority. There was only one way out: to conduct an unprecedented review, a special commission composed of the most prominent professors and skeptics, was convened to examine his methods. This was not merely an examination, it was a public trial of the future of medicine. Fauchard did not falter. He arrived not empty-handed, nor with excerpts from ancient treatises. He brought evidence. On his table lay his instruments, crafted for surgical precision. Beside them were models of jaws, demonstrating complex carious processes, and his innovative filling methods. He showed how tin, heated to the correct temperature, tightly filled the cavity, insulating the nerve and preventing further decay. He explained the anatomy of the tooth, debunking myths about toothworms and bad humors. His words were supported by precise drawings he had made himself. Then he presented his patients, not just words, but living testimonies. Sailors who had recently suffered from rotting teeth now smiled, showing strong, filled teeth. Ladies from high society, who had hidden toothless mouths for years, could now speak and eat thanks to his ivory. Prostheses, secured so reliably that they wouldn't fall out during conversation. Fauchard explained the principles of fixation, demonstrated how wire clasps provided stability, and even showed how patients should care for them to maintain hygiene. The commission members listened, at first with disbelief, then with growing astonishment. Their own methods were powerless against these problems. They saw only despair. Fauchard, however, offered solutions. He explained the causes, showed the process, and demonstrated the result. He didn't just treat, he healed. The silence in the hall was deafening. The skeptics could find no arguments against such obvious facts. Their own patients continued to suffer. Fauchard's patients lived full lives. It was not a matter of theory, but of practice. Not a matter of dogma, but of evidence. The commission's verdict was unequivocal. They could not deny the obvious. Moreover, they were forced to admit that before them was not a charlatan, but a true scientist, ahead of his time. Fauchard's work, The Surgeon-Dentist, or A Treatise on the Teeth, was not merely approved. It was recommended for study by all practicing physicians. It became mandatory reading for students. It attained the status of a foundational textbook, a monumental work upon which a new medical discipline was to be built. Pierre Fauchard, yesterday's outcast, called an impostor, transformed into an unquestionable authority. His name became synonymous with progress. His methods, previously ridiculed, were now actively studied and implemented. He did not merely win an argument, he changed the rules of the game. He not only gave dentistry its name, but also secured its official recognition, establishing it as an indispensable, respected part of medicine. He laid the cornerstone upon which the magnificent edifice of modern dentistry would be erected. The approval of his work was not just a personal victory, it was a turning point for all of medicine. From that day forward, toothache ceased to be a death sentence. Death from oral infections, once commonplace, began to recede. Fauchard's treatise revolutionized the approach to treating tooth decay. Instead of barbaric extraction, he offered tooth preservation. The technique of cleaning the cavity and then tightly filling it with tin or lead became a standard procedure. This not only relieved pain but also halted decay, protected the nerve, and preserved the tooth's functionality for years, sometimes decades. His prosthetic methods, described in meticulous detail, for the first time gave people hope of restoring lost teeth. Ivory prostheses, held by wire clasps, allowed not only eating and speaking, but also restored confidence. This was not a cosmetic solution, but a full-fledged medical intervention. Fauchard also laid the foundations of orthodontics. He described methods for straightening teeth using metal plates and ligatures. This was an entirely new direction, aimed not only at improving aesthetics, but also at correcting bites and preventing further problems with digestion and speech. For the first time in medical history, Fauchard systematized knowledge about oral hygiene. He explained how to clean teeth, how to care for prostheses, and how to prevent diseases. This was revolutionary. Previously, prevention was not considered at all. The reduction in deaths from sepsis caused by advanced dental infections became evident, whereas purulent abscesses and phlegmons from the oral cavity often led to fevers, generalized blood infection, and fatal outcomes. Now, thanks to timely treatment and removal of the source of infection, this threat significantly diminished. The quality of life for millions of people changed forever. Pain ceased to be a constant companion. People could eat properly, which directly affected their overall health and life expectancy, especially among sailors and the poor, for whom tooth loss meant starvation. Fauchard's treatise, translated into several languages, spread throughout Europe. His ideas permeated medical academies, changing curricula. The surgeon-dentist became the cornerstone for the formation of a new medical specialty. Dentistry was no longer the domain of barbers. It became a science requiring deep knowledge of anatomy, physiology, and surgery. Within a few decades, the first specialized departments and clinics, entirely dedicated to the treatment of teeth in the oral cavity, began to appear in many European countries. The profession of dentist ceased to be marginal. It gained official status, educational requirements, and ethical norms. This was a transition from a craft to a full-fledged medical discipline, recognized and respected. Of course, the path was long. Not everyone accepted his methods instantly. Resistance from the old school continued for a long time. But the seed had been sown, and it sprouted. The cost of this legacy? Years of painstaking labor, countless experiments, a struggle against ignorance and entrenched prejudices, personal time, energy, and a refusal to take the easy path. But the result? A world where toothache is not a death sentence. A world where millions of people can smile, eat, and speak without suffering. This was not merely a medical revolution. It was a humanitarian victory. This humanitarian victory, which changed the destinies of millions, was not simply the result of new methods. It embodied a fundamental principle. Truth is born not from dogma, but from relentless, painstaking pursuit. Pierre Fauchard proved that true authority lies not in university degrees or centuries-old traditions, but in hands that create, in eyes that see, in a mind that dares to question and verify. He was a man without formal medical training who dared to challenge the entire establishment. He rejected the easy path, the convenient explanations, the blind adherence to ancestors. Instead, he chose the path of a lone individual, a path of constant questioning, countless experiments, and open dissemination of knowledge. The cost of this legacy was immense. Years of personal time, countless trials and errors, fierce resistance, ridicule, and attempts to discredit him. He fought not only against diseases but also against ignorance, entrenched prejudices, and the unwillingness to acknowledge the new. His legacy is not just a collection of revolutionary techniques, fillings, and prostheses. It is a philosophy. It is a universal lesson that true progress requires not only genius, but also incredible courage. The courage to admit one's own ignorance, the courage to go against the current, the courage to share one's discoveries, even knowing that one will be met with ridicule and rejection. And the paradox of his greatness is that, as an outcast, he became a cornerstone. By dismantling old notions, he didn't just replace them with new ones. He built an entirely different world where pain is not a condemnation and knowledge is accessible to everyone. He laid the foundation for future generations of doctors who, building on his work, could refine and expand his ideas. His life is living proof that one person, driven by compassion and an insatiable thirst for knowledge, can change reality for all of humanity. He simply refused to tolerate suffering. He believed that knowledge should serve life. And this is his eternal testament, shining through the centuries, reminding us, the future is born from the courage to see, the courage to act, and the courage to share.